In the fight against malaria, the smallest details can make the biggest difference. This is where data plays a big part in changing lives.
When you hear she buzzing, big problems coming, big problems coming, big problems coming. Look this little mosquito.
In this third part of our series, we turn our lens to the regional level, where breakthrough action and vector control services have been harnessing the power of data to guide impactful malaria interventions. For the VCS teams working at the regional level, data highlights gaps and directs resources where they're needed the most.
We've had quite a progress as regards to using data in our region for different things. Our regular daily case register that we have captures a lot of important aspects as regards to testing and treatment. As we see, the continuous monitoring format have additional data. So this data now we would use it for reporting, show how persons are using the treated net compared to years before to different areas. Of course, Breakthrough Action was the one that's responsible for creating that form. They also was the one that was responsible for the supervisory tool that we have for the volunteer. They enhanced it. And that is also used in data reporting, how much volunteers have adequate supplies, when they're stuck out, when they need extra supplies, how many visits are done, the signs that they have, if they're out of signs, if they're out of books, all of that are captured in that supervisory tool. We use data for budgeting. We use data, of course, for the purchase of our vehicle that we got in 2022. And I would say that's one of the most significant things that we use our data to get. We would have used our data from our national malaria system, also from the continuous monitoring form, where we highlighted where the volunteers are located and how to reach them, by creating maps and the highest cases of malaria, and we showed that why it was important for us to get this vehicle for the region.
Region 7 stands out as one of the most malaria-affected regions in Guyana, where dense forests, remote mining camps, and rugged terrain pose obstacles to healthcare access. In this challenging landscape, data emerges as a vital tool, shining light on the unique lives of miners and shaping targeted interventions.
We conduct a number and a series of health education activities to sensitize the population as to what is malaria, what are the signs and symptoms of malaria, the importance of seeking medical attention as early as possible, and also the importance of using mosquito nets to assist to reduce the number of the population of mosquitoes in our environment.
Through Breakthrough Action's collaboration with VCS to capture significant data, culturally relevant SBC materials were developed, leading to a notable impact. Minors exposed to these interventions were 56% more likely to seek prompt care for a fever compared to just 34% of those with no exposure.
We tried to capture the percentage of minors that sleep under the LLIN, which is a long-lasting insecticide net, and we noticed that from 2020, there was 17 and 34% respectively. We noticed in 2021 there was a decrease in the percentage of minors that sleep under a net for regions 7. We noticed for the same period between 2020 to 2022, the percentage increases for both regions except for 2021 when region 7 shows a decrease in percentage. This percentage started declining though in 2020. Now in 2022, there was a mass net distribution by the National Malaria Program, and hence more people had access to LLI, and hence more the usage increased for those two regions.
As the battle against malaria continues, Region 7 serves as an example of how data-driven approaches backed by breakthrough action can transform outcomes in even the most challenging environments.
Data, like I mentioned, is very important in planning anything, in budgeting for anything. So it's quite essential in getting anything done. And malaria has one of the most widespread and comprehensive data in the country, right? It's something that you can use to get what you need, but you just need to use it the right way.